So we started coming to Dr. Kilbane because of our 2-year-old daughter, Hayden. She was dealing with constant illness, runny nose that would turn into a cough, that turned into wheezing. She was diagnosed by her pediatrician with asthma. I did the mom thing of saying, I want a second recommendation, a second perspective on this. Went to the specialist who he just recommended that we were doing everything right. She did need to be on a daily inhaled steroid, and he said it's inflammation, but there really was nothing else that he could recommend that we weren't doing, but she was still just getting so sick all the time. And it's hard when you feel like your kid is sick like that.
And lots of antibiotics, right?
Yes, we had done antibiotics for various infections. The breaking point for me was when she had pneumonia in September, before cold and flu season even began, and we were having to do antibiotics for that and do all sorts of breathing treatments, which she needed, but it was just a cycle. So I found Dr. Kilbane through some great moms on Facebook who, when I said, who are medical doctors who understand traditional medicine, who also understand other things that can help us just take a different approach to this, who maybe have more tools that we're just not using, food and supplements and just other integrative therapies, and this really has been a blessing for us.
And we took a little, so how has the experience been going through the integrative process with our practice for you?
I think it's been really beneficial for all of us.
Most definitely.
And I think it's been a sacrifice, but our quality of life before this is totally, the sacrifice is worth it, because we were sick and we were frustrated and we were tired. And when you're sick and tired of being sick and tired, you just do what it has to take.
Yeah.
And so for one of the things for us, we've eliminated dairy. We chose to also eliminate gluten. We chose to pull her out of daycare for 6 weeks to just reset her system and help her build a robust health before she goes back into daycare.
Yeah. And what have you seen with her health?
Completely different kid. High energy. She's been a couple months without being sick at all.
Yeah, like no runny nose. The one runny nose that she bounced back from like in 4 days. It was unbelievable.
Yeah. And how old is Hayden?
She's 2.5.
Yeah.
Mm-hmm.
Okay.
Yeah.
And Dad, you also had a lot of health improvements through this process. Do you mind sharing?
Yes. So part of ours was going dairy-free, and in the process of doing that, I recognized a few things about my health and my gut health from dairy consumption, where I have always struggled with eczema, and kind of identified that the culprit for that was dairy and milk. And I had also started in the past year or so dealing with digestive health, and that I had, prior to being here, I'd identified that it was dairy related. And
you were having abdominal pain, right?
Like
almost every day?
Yeah, well, when I ate dairy, or
Okay.
when I sat down or had a bowl of ice cream or ice cream cone or a milkshake or anything that had more than 2 slices of pizza, I would get just this really bad stomach pain.
And you were getting regular headaches too, right?
And yes.
And taking medications for those symptoms. He was taking, a multi-symptom Imodium, and he was taking, pain relievers for his headaches. And since we stopped,
since we've gotten off gluten and dairy, I have not taken any of that and have not had an episode of either one of those.
Yeah. And so for you all, because you kind of knew for you what was triggering it, was it helpful having the support to really change your lifestyle?
Absolutely.
And knowing the science behind it?
Yes. Learning the science behind it is what has helped me stick with it, rather than like fall back to any of the cravings or like the just being accessible.
Yeah.
You know. So, or convenience of our old diet. I think that's what was hard to get away from, was the convenience of just eating things.
And just knowing a new system, right?
Yeah, I think it really changes your understanding of what you eat and how it affects your body. Not just immediately, right? Because he would have immediate symptoms of like, oh, my stomach hurts. But really also that long term, and for us, I think this process will be a game changer for our daughter's health and for our health in the long run, right?
Yeah.
That we're kind of stopping this before it got worse, right? Before asthma became a lifelong thing for her.
And so her main issues, it was wheezing.
It was wheezing.
Eczema.
She had eczema, especially during the winter. And
current
right now
year.
it's January, and we're just seeing a little teeny bit of eczema, but it's way less than we would normally see this time of year.
And then ear.
She had ear tubes really early on, and we were thankful at the time that we did them. But now, looking back, you wonder, was there a connection that maybe we didn't have to go that route at that time? I don't know. It worked for us at the time, but maybe there was another way that just wasn't on the table that we knew about, and now we know.
Yes. And do you have any advice for other parents of kids who are recurrently sick? That what would you tell them?
I would say listen to your gut. If you feel, I know that people say it all the time, but if you feel like that maybe there is a connection. There is probably a connection, and your traditional pediatrician may not have the bandwidth, is what Dr. Kilbane likes to say, to really focus on the depth of changes that maybe would improve your child's health in totality.
Yeah.
And so really, it's worth the sacrifice. It is a game changer, and that's what we needed. We needed a game changer. We were at that place, and you don't need to wait to get to that place.
Yeah.
I'd say seeing your kid and your family healthy or on the road to being healthy is totally worth any other sacrifice that would come with it.
Yeah. Awesome. Well, thank you for sharing this with us today.
Thanks.